Hi there, and welcome to the first lecture in the pediatrics unit. So what we are going to be covering today is theories of growth and development. Now, if you've taken Psychology 100 or Psych 101, you're going to know some of these. And this is just the beginning of how we implement care differently into the younger population that we see, that pediatric population. So these are really important because it decides how we interact with those pediatric patients, and is it appropriate, and is it in a way that fosters safe patient care. So what we're first going to talk about here is psychosocial development, and this is talking all about Erik Erikson and his theory. So Erikson's theory of psychosocial development describes the human life cycle as a series of 8 ego-developmental stages, and this happens all the way from birth through death. Each stage presents a psychosocial crisis, as one might say, and the goal of which is to integrate physical and societal demands. So the result of one stage may not be permanent, but it can actually be changed as experiences later in life happen. If you think about yourself, you're not the same person that you were last year, 5 years ago, 10 years ago, and it's because we're growing, we're moving through these different developmental stages. When we talk about cognitive development, this is talking about Jean Piaget. So the theory behind Jean Piaget is that cognitive development defines cognitive acts as ways in which the mind organizes and adapts to its environment. This is also known as mental mapping, if you've heard it referred to that way. So we have schemata, and schemata are categories that an individual forms in his or her mind to organize and understand the world around them. Adults obviously are going to have a wider variety of schemata to understand the world versus a young child. That's just going to be the experiences that that child has had. And if we think about how we've all had different childhoods, we are only going to be exposed and experienced in very small and limited functions. Then we have assimilation. Assimilation is the ability to incorporate new ideas, objects, and experiences into the framework of one's thoughts. And then we have accommodation. And accommodation is the ability to change and introduce new ideas, objects, or experiences. Accommodation changes the actual mental structure so that new experiences can be added. So schemata, assimilation, and accommodation all fall under cognitive development. So Erik Erikson, we're going back to psychosocial development here for a moment. Erik Erikson has those 8 ego stages, whereas Jean Piaget has only a few stages of cognitive development. Those are the sensory motor, pre-operational, concrete, operational, and formal operations. We'll also spend a little bit of time talking about moral development with Lawrence Kohlberg, as well as psychosocial development with Sigmund Freud. Now we're going to be doing an in-class activity where you guys are going to need to look up all of these different stages. And that's how I really want you to grasp how your nursing interventions and nursing actions change depending upon the age of your client. So I want you to bring your book to class to be able to look back and look into all of these, whether it be Lawrence Kohlberg with moral development, Sigmund Freud with psychosexual development, Erik Erikson, or Jean Piaget. So I just want you to know that going forward. Let's talk a little bit about promoting health in our infant population. So health promotion of infants, this could be anywhere from 2 days old to 1 year. Now some of the expected growth and development that you might see here is with infants, we're definitely going to be tracking their size. We're using weight, height, and head circumference measurements. Infants gain approximately 1.5 pounds per month during the first 5 years of life. Height, infants are growing approximately 2.5 centimeters per month the first 6 months of life. You're going to start looking at dentition. 6 to 8 teeth should erupt in infants' mouths by the end of the first year of age. Some children show minimal indications of teething, such as sucking or biting on their fingers or hard objects and drooling. Others are quite irritable. If you have kids, you might know that. I remember my niece was just horrible when she was teething. Oh, she was so irritable. She had difficulty sleeping, there was a mild fever, as well as she would rub her ears. So just note that dentition and that some children may show minimal signs and others might be incredibly irritable. All right, so that's really all I want to say about the physical development. When we talk about cognitive development, let's start there. John Piaget says that this is the sensory motor stage, right? We're birth to 24 months. Infants are progressing from reflexive to simple repetitive or imitative activities. Infants need to learn to separate themselves from other objects in the environment. And object permanence. This is the process by which infants learn that an object still exists even when it's out of view. This could be a parent leaving, this could be a toy. We've probably seen that when you take a toy away from an infant and they can't see it, it creates this separation anxiety. And this occurs at approximately 9 to 10 months of age. We're also starting to see mental recognition and representation. They're recognizing symbols, all of that. So that's in the cognitive development. Language-wise, we're going to see crying, right? Infants are crying, they're cooing, they're responding to noises, they might laugh and squeal. But we really don't see much comprehension until they reach about the first year of life, till about 1 year old. In psychosocial development with Erikson, this is trust versus mistrust, right? Birth to 1 year. The infant begins to learn delayed gratification. Failure to learn delayed gratification leads to mistrust. So this is all about the development of trust. Meeting needs, meeting comfort, feeding, stimulation, and caring needs. The parents are very involved in this stage of care. So achieving this is really based upon the quality of the caregiver to infant relationship. What if mom or dad isn't there? So the trust definitely developed by meeting comfort, feeding, stimulation, and caring needs, as I've already said. On a social point, the attachment is seen when bonding with their parents. You get the separation anxiety at about 4 to 8 months. Now, what about age-appropriate activities? What do you think? What would be age-appropriate for an infant? They have short attention spans, right? So rattles, mirrors, blocks, brightly colored toys are all age-appropriate activities for this type of patient in this age group. So moving on to nursing in the infant promotion of health. How can we as the nurse promote this in our patients that are in the infant age range? Well, immunizations. This is huge. Education about immunizations to the parents is also a big portion of this. We're looking at hepatitis B, DTaP, rotavirus, pneumococcal vaccine. What are the appropriate immunizations that these patients in this age range should have? Is this providing a schedule to the parents? Is it doing reminders as far as calling them and telling them, hey, at our next checkup, this is what we're going to be giving your child? Nutrition-wise, breastfeeding or formula, of course, breast is best, but some infants that might not be possible, as well as for the mom, that might not be something that is feasible. Solids are being introduced at 4 to 6 months. We are absolutely monitoring for allergic reactions, and this should be part of your education to the patient, as the patient's family, of what type of reaction might you see. Could it be swelling? Is it hives? Anytime that they're introducing new foods, always being on the lookout for any type of allergic reaction and to not delay care. Have them come into the emergency room or set something up with their primary care provider. Needed nutrients. Absolutely, we need iron and vitamin D for these patients in this age range. Those two specifically. So how are we going to prevent injury? Choking hazards, right? Grapes, coins, check the room. Ensure that the parents know that it's not appropriate to give an infant something like an entire whole grape, because that can cause an airway obstruction and a choking hazard. Crib mattresses need to be at the lowest position with rails up, safety gates at the top of stairs, locks on medicine cabinets. All of those things. We're preventing burns, making sure that the parents are checking the water temperature of a bath before the infant is going to be bathed. Falls, poisons, I alluded to that a little bit. So nursing in the infant, right? We need to promote nutrition. We need to prevent injury, and this is tons and tons of education. We're talking about immunizations, as well as what we talked about on the last page. If this was your patient that you got, an infant patient, how would you gain the trust of that patient? Is it playing with the toys, those rattles, those brightly colored blocks? How would that go? So that's all I want to say as far as nursing an infant promotion of health. So here's a little question. So a nurse is providing education about introducing new foods to the parents of a 4-month-old. To best supply needed nutrients, the nurse should recommend that the parents introduce which of the following foods? Strained yellow vegetables, iron-fortified cereals, pureed fruits, or whole milk? Take a moment to answer that. The correct answer is B, iron-fortified cereals, and this is because we need that high iron content. Iron and vitamin D were both of the needed nutrients for this age range, so iron-fortified cereals is the correct answer. On the next one, we are going to talk about promotion of health in toddlers.